Is it dangerous to hold in your pee? I mean, every now and then we all have to hold it in, right? A long car ride, a long meeting, things like that. But is it dangerous? I'm going to give you the answer, guys. I'm Dr. Jen Caudle. Now, first of all, a couple quick facts about urination and the bladder. Urination is very important for our body because, urine helps filter out waste from our body, okay? We need to urinate because we need to get rid of waste, right? And urination is one way that we do that. The second thing is that the bladder holds about 400 to 500 milliliters of fluid. That's about 2 cups, okay? To give you an idea of how much urine it holds. And we should be urinating in a normally about every 3 to 4 hours or so, okay? Now, of course, it's going to depend on how many liquids you've had to drink. It's going to depend on what underlying medical conditions you have. It's also going to depend on what medications you take, right? Like if you're on diuretics, you may be urinating more than if you weren't. Okay, so that's a few basics. Now, what I would say in terms of answering this question is we all have to hold our urine at some point in time. And to have to hold your urine, hold your pee every now and then, honestly, that's not a big deal if it's every now and then. The issue comes if you are doing it habitually, if you are doing it quite frequently, if you're holding your urine for long periods of time. And I also want to remind us that there are some folks that say have issues with their bladder, neurogenic bladder, etc. Okay, I'm not talking about that. I'm just talking about the simple situation where you have the ability to go, but you are not going. And I also want to bring out, too, that there are some people who say are uncomfortable in public restrooms and stuff like that. And that is something that I bring up because if that is you, that's something you want to sort of investigate and evaluate because it may be impacting your ability to urinate on time, especially if you're out and about. Anyway, I digress. Let's get back. So if you hold your urine every now and then, not a big deal. It's if it's done frequently, a lot, for long periods of time, etc. And you're probably saying, well, what could happen? Well, first of all, it's uncomfortable, right? You feel that pressure. You can get some pain, pelvic pain down here in your lower back, etc. from doing that. Okay, that goes without saying. But there are other things. The risk of a UTI or urinary tract infection goes up with urinary retention or holding your urine, okay, because it sort of creates an environment where bacteria can set in. Now, this is not the thing that happens to everyone who holds their urine, but it's a possibility if you hold your urine for long periods of time and frequently, okay? By the way, I'll link a video here with signs and symptoms of urinary tract infection, so you can take a look at that. I'll also put in the description of this video. The other thing is holding your pee or urine too long can sort of affect the muscles that you use when you urinate, and it can affect them in such a way that a couple things can happen. Number one, from holding your urine so much, you can actually get what we call urinary incontinence, which means you could actually leak urine or dribble a little bit when you don't intend to go. The other thing that can happen is you may not fully empty your bladder, which means that when you do go, you're not able to get all that urine out, and that's not what we want either, okay? And then I should mention that in very, very severe cases, and often this is when there are other things going on, there is a possibility of bladder rupture. Again, that is not a first line thought when it comes to holding your urine. That is a way down the line in very extreme cases or when other things are happening. But yeah, bladders can rupture, okay? Again, not the first thing we think of, but potentially possible. The point is, you don't want to do this habitually and routinely, okay? You want to make sure that you're going to the bathroom on time. You want to go to the bathroom when you have the cessation to go. There are other tips on bladder stuff that I have for you. By the way, if you deal with urinary incontinence, I have a video on that. I will link that here as well. But just, if you have any questions or concerns about how you are urinating, make sure you chat with your doctor because actually there are a lot of lifestyle changes and things we can do to help make urination better. The other thing I would say is try to avoid constipation, because constipation can actually impact your bladder and ability to urinate. I'll link some videos on constipation as well. Guys, I hope this is helpful. It's just a quick and dirty about holding your urine. Short term here and there, not a big deal, but long term and frequently, yeah, could be a big deal, okay? Let me know what you think in the comments. Write them down below. I'm Dr. Jen Caudle. On Facebook, please like and follow my page. YouTube, subscribe to my channel. Click the little bell for updates. Guys, follow me on TikTok, WhatsApp, Instagram, etc. at Dr. Jen Caudle. Go to drjencaudle.com for my free health newsletter. Please sign up there. Guys, love you. Bye.